Bismillah ar-Rahman ar-Rahim and Assalamu alaikum. This is Dr. Ali Hasnain Sheikh. Considering the anatomy of ear is divided into three parts: the external ear, middle ear, and internal ear. The external ear consists of auricle or pinna, the external artery, meatus, and canal, and the tympanic membrane. In fact, whole of the tympanic membrane should not be considered as a part of external ear. It is the outer epithelial layer of the tympanic membrane which is the part of external ear. The auricle or pinna. The entire pinna except lobule is made up of single piece of yellow elastic cartilage and is covered by perichondrium and skin. There are various elevations and depressions on pinna. Cartilage is deficient between tragus and crus of helix, and this is a site for end-oral incision. The cartilage from tragus, perichondrium, and fat from the lobule are different graft materials which are taken from pinna. Now here is a picture which is showing different parts of pinna, this being the crus of helix, the end helix, and the two crura of end helix, the tragus, the ear lobule, and the depressions like cavum concha, cymba concha, and the triangular fossa. The external auditory canal extends from bottom of concha to the tympanic membrane. It measures about 2.4 cm or 24 mm along its posterior wall. It is divided into two parts, the cartilaginous and the bony part. It is not straight. Straightening can only be achieved by pulling the pinna upward, backward, and laterally. The external auditory canal, the outer one-third being the cartilaginous and the medial two-thirds being bony part. Again, the external auditory canal along with the pinna and the tympanic membrane. The cartilaginous part of the external auditory canal is outer one-third, and it is a continuation of pinna. The overlying skin is thick and contains ceruminous and pilosebaceous glands which secrete wax. Hair is only confined to outer meatus, and therefore furuncles or boils, which are basically acute staphylococcal infection of the hair follicles, these are only seen in the outer one-third of the canal. Well, the bony canal is medial two-third, that is the 16 mm, and the skin lining bony canal is thin and continues over the tympanic membrane. It is devoid of hair and ceruminous gland. 6 mm lateral to the tympanic membrane, there is narrowing in the bony part which is called isthmus. The anteroinferior part of the deep canal presents a recess called anterior recess. The tympanic membrane forms partition between the external and the middle ear. It is obliquely set so that the posterior part is more lateral than the anteroinferior part. It is 9 to 10 mm tall, 8 mm wide, and 0.1 mm thick. It is divided into two parts, the pars tensa and the pars flaccida. The malleolar folds, the anterior malleolar fold and the posterior malleolar fold, it divides the tympanic membrane into the upper pars flaccida and the lower pars tensa. Here you can see the handle of malleus in the pars tensa, the cone of light. You can divide the pars tensa into four quadrants: the antero-superior quadrant, the antero-inferior quadrant, postero-inferior quadrant, and the postero-superior quadrant. This is the tympanic membrane of the right ear. How can I say that this is the tympanic membrane of the right ear? By looking at this lateral process of malleus. If this process is on the right side, then this is the right tympanic membrane. If this process is on the left side, then this would make it the left tympanic membrane. But in this case, this is the tympanic membrane of the right ear, and the cone of light is always in the antero-inferior quadrant. The lateral process also determines the anterior half of the tympanic membrane from the posterior half of the tympanic membrane. So this is the anterior half of the tympanic membrane, and this is the posterior half of the tympanic membrane. Now in this case, the lateral process is on the left side. So this is the tympanic membrane of left ear. Pars tensa forms most of the tympanic membrane. The periphery is thickened to form fibrocartilaginous ring called annulus tympanicus, which fits into tympanic sulcus. The central part of the pars tensa is dented inwards at tip of the malleus and is called umbo. A bright cone of light is seen radiating from the tip of malleus to the periphery in the anteroinferior quadrant. Well, the pars placida is deficient. In case of pars placida, the tympanic sulcus is deficient superiorly at the notch of Ravenous, and from the ends of this notch, two bands, the anterior and posterior medial folds, are prolonged to the lateral process of the malleus. The pars placida is situated above these folds. It is lax and appears slightly pinkish. The middle fibrous layer is deficient in pars placida. The tympanic membrane has an outer epithelial layer which is continuous with the skin lining the meatus, the middle fibrous layer which encloses the handle of malleus, and inner mucosal layer which is continuous with the mucosa of the middle ear. The external canal is related superiorly with the middle cranial fossa, posteriorly to the mastoid air cells and the facial nerve, inferiorly to the parotid gland, and anteriorly to the temporomandibular joint. Regarding the nerve supply of the external ear, it is mainly supplied with the greater auricular nerve, lesser occipital nerve, auricular branch of the vagus nerve, and the auricular temporal branch of fifth nerve. Middle ear. Middle ear, together with eustachian tube, auritus, antrum, and mastoid air cells, is called the middle ear cleft. It is lined by mucous membrane and filled with air. It's like a cuboid having six sides: the roof, floor, medial and lateral walls, the anterior and posterior walls. The middle ear contains air, three ossicles, that is malleus, incus and stapes, two muscles, the tensor tympani and stapedius, and the nerves like tympanic plexus and chorda tympani nerve. The malleus has a head which has a facet where the body of incus is attached. It has a neck, a lateral process, the handle of pallius or manubrium, and an anterior process. Whereas an incus has a body which has a facet where head of the malleus is attached, a short process, and a long process. The tip of the long process of incus is called lenticular process. At this side, it is attached to the head of the stapes. The stapes has a head, a neck, the two crura, the anterior crus, the posterior crus, and a base which is attached to the oval window. So here is the cuboid of middle ear cavity, having the roof, the floor, the anterior wall, the posterior wall, the medial wall, and the lateral wall which is formed by the tympanic membrane. The anterior wall has an opening and a canal for the tensor tympani muscle, an opening for the eustachian tube, and a bone which separates the middle ear cavity from the internal carotid artery. The floor which separates it from the jugular bulb, the roof which separates the middle ear cavity from the middle cranial fossa. The medial wall has a bulge called promontory which is formed by the basal coils of the cochlea, the oval and round windows, and the horizontal part of the facial nerve, whereas the posterior part has the vertical part of the facial nerve and a pyramidal process, and superiorly there is an opening called auritus through which the upper part of the middle ear cavity, that is attic, communicates with the mastoid air cell system. Well, in detail, the roof is lined by a thin plate of bone called tegmen tympani. It extends posteriorly to form roof of auritus and antrum, and it separates tympanic cavity from middle cranial fossa. And floor has a thin plate of bone which separates tympanic cavity from jugular bulb, sometimes congenitally deficient, and jugular bulb projects into the middle ear separated from cavity by mucosa only. Anteriorly, there is a thin plate of bone which separates the cavity from internal carotid artery. It has two openings, the lower one for the eustachian tube and the upper one for canal of tensor tympani muscle. The posterior wall lies close to the mastoid air cells. It has bony projection called pyramid. An opening through which attic communicates with antrum is called auritus. Facial recess or posterior sinus is a depression in the posterior wall lateral to the pyramid. Medial wall is formed by labyrinth, presents as a bulge called promontory, which is due to the basal coil of cochlea. It has two windows, the oval window, into which is fixed footplate of stapes, and round window, which is covered by secondary tympanic membrane. Above oval window is canal for facial nerve. The lateral wall is formed largely by the tympanic membrane and to a lesser extent by bony outer attic wall called scutum. Mastoid antrum. Large air containing space in upper part of mastoid and communicates with the attic through the auditus. Roof is formed by tegmen antri which separates from middle cranial fossa. Lateral wall is marked externally on the surface of mastoid by suprameatal triangle or McEwan's triangle. Here you can see the middle ear cavity is communicated posteriorly through an auditus to the mastoid antrum and air cell system. Well, mastoid air cell system or mastoid bone can be well pneumatized. That is, mastoid air cells are well developed and intervening septa are thin. It can be diploitic. Mastoid consists of marrow spaces and few air cells. In case of sclerotic mastoid bone, there are no cells or marrow spaces. There are different air cells which are named as zygomatic cells, tegmen cells, perisinus cells. And lastly, the mastoid antrum, which is also an air cell. And if someone asks you what is the name of the largest mastoid air cell, then that is the mastoid antrum. Mastoid antrum is the largest air cell of the mastoid air cell system. Eustachian tube connects tympanic cavity, that is middle ear cavity, with the nasopharynx. It is 36 millimeters long. The lateral one-third is bony, while the medial two-thirds is cartilaginous. At the junction of the two, there is a narrowing called isthmus. Normally, it remains closed and opens during swallowing, yawning, and vomiting. Here, you can see eustachian tube connecting the middle ear cavity with the posterior part of the nose, that is nasopharynx. In children, this tube is more wider and smaller and straighter, whereas in adults, this tube is narrower and more long and curved. That is why the chances of spread of infection from the nasopharynx to the ear is lesser in adults as compared to the children or infants. The eustachian tube is lined by pseudostratified columnar in cartilaginous and columnar in bony part with several mucous glands. Tympanic cavity is lined by ciliated columnar epithelium in anterior and inferior part and cuboid in the posterior part, while the epitympanum or attic and the mastoid air cells are lined by flat non-ciliated epithelium. Well, coming to the anatomy of the inner ear, it is an important organ of hearing and balance. It consists of two parts, the osseous labyrinth, a series of cavities within the petrous part of the temporal bone, and the membranous labyrinth, a series of communicating membranous sac and ducts contained within the bony cavities. The membranous labyrinth is filled with a clear fluid called endolymph. Space between the membranous and bony labyrinth is filled with perilymph. Well, this picture is showing the bony labyrinth and the membranous labyrinth within the bony labyrinth. The anteriorly is the cochlea, in the middle is the vestibule, and posterior are the semicircular canals. Within the cochlea is the cochlear duct, the membranous part. Within the vestibule, the saccule is anteriorly and utricle is present posteriorly. And within the semicircular ducts are present semicircular canals. The bony labyrinth is an osseous labyrinth and consists of three parts: the vestibule, semicircular canals, and cochlea. These are the cavities hollowed out of the substance of the bone and lined by periosteum. They contain a clear fluid, the perilymph, in which the membranous labyrinth is situated. The cochlea, the vestibule, and the semicircular canals. The lateral semicircular canal, the posterior semicircular canal, and superior semicircular canal. Within the bony canal is the membranous labyrinth, the cochlear duct, the saccule, utricle, and semicircular ducts. The vestibule is an osseous labyrinth and is situated medial to the tympanic cavity, behind the cochlea and in front of the semicircular canals. Somewhat ovoid in shape but flattened transversely. It measures about 5 mm from before backward, the same from above downward, and about 3 mm across. In its lateral or tympanic wall is the fenestra vestibuli, close by the base of the stapes and annular ligament. Inside of its medial wall presents two recesses, a spherical which lodges saccule and an elliptical one which lodges utricle. Below the elliptical recess is an opening of aqueduct of vestibule through which passes an endolymphatic duct. In the posterior superior part are the 5 openings of the semicircular canals. There are 3 semicircular canals, the superior, posterior and lateral. Each measures about 0.8 mm in diameter and presents a dilatation at one end called the ampulla, which opens independently into vestibule and has a non-ampullated end. The non-ampullated ends of the posterior and superior canals unite to form a common channel called pars commune. Thus, the 3 canals open into the vestibule by 5 openings. The cochlea is coiled tube making 2 and 3/4 turns round a central pyramid of bone called modulus. Conical in form, placed almost horizontally in front of vestibule. Its apex is directed forwards and lateralwards. The base corresponds with the bottom of the internal acoustic meatus. Around the modulus is thin plate of bone called osseous spiral lamina. It contains 3 separate compartments: the scala vestibuli, closed by the footplate of stapes; scala tympani, closed by secondary tympanic membrane; and the scala media. Scala vestibuli and scala tympani are filled with perilymph and communicates with each other at apex of the cochlea through an opening called helicotrema. Well, this is the membranous labyrinth within the cochlea. This is called the cochlear duct or scala media. It is bounded inferiorly by the basilar membrane and superiorly by the Reisner's membrane. Reisner's membrane separates the scala media or cochlear duct from the scala vestibuli, and the basilar membrane separates the scala media or the cochlear duct from scala tympani. Within the cochlear duct or scala media is the organ of Corti, which has hair cells which rest on the basilar membrane. It has the tectorial membrane and stria vascularis, which forms endolymph within the scala media. The membranous labyrinth is lodged within the bony labyrinth. It contains fluid called the endolymph. It consists of utricle and saccule, cochlear duct, 3 semicircular ducts, endolymphatic duct and sac. The cochlear duct, the saccule and utricle within the vestibule, the semicircular canals within the semicircular ducts within the semicircular canals. The utricle lies in the posterior part of the bony vestibule. It receives 5 openings of 3 semicircular ducts, also connected to saccule through utriculo-saccular duct. Sensory epithelium is called macula and is concerned with the linear acceleration and deceleration. The saccule lies in a bony vestibule anterior to the utricle and opposite to the stapes footplate. Its sensory epithelium is called macula and it responds to the linear acceleration and deceleration. The cochlear duct is spirally arranged tube enclosed in the bony canal of the cochlea. It is triangular in cross section. The basilar membrane supports organ of Corti. Reisner membrane separates it from the scala vestibuli. The stria vascularis contains vascular epithelium and is concerned with the secretion of endolymph and is connected to the saccule by ductus reunions. The semicircular ducts are 3 in number. It corresponds exactly to the 3 bony canals. About 1/4 of the diameter of the osseous canal. Open in the utricle, it is ampullated at one end, which contains the sensory epithelium called crista ampullaris. The endolymphatic duct and sac, these are formed by union of 2 ducts, one each from utricle and saccule. It passes through vestibular aqueduct. The terminal part is dilated to form endolymphatic sac, which lies between the layers of dura. Thank you very much. If you have any question, you can ask me in the WhatsApp group. I would be obliged to respond you accordingly. Thank you again.